Welcome to Satu Career 2.0 online nursing channel. This is NIMHANS and AIIMS test series most important questions. This is a continuation of yesterday's video. Here we are going to see another 20 questions from Psychiatric Nursing. These questions will be very useful when you are writing NIMHANS Nursing Officer Exam 2019 on August 4th. Before going to see these questions, please subscribe to our channel if you have not yet subscribed. I also thank all the subscribers of Satu Career 2.0 Nursing channel. The big success is from your motivation and from your support. Also click the bell icon to get the latest notification about the new videos. Before seeing the questions of today, I like to discuss about the syllabus of NIMHANS Nursing Officer exam. Many of you have asked me what is the syllabus of nursing officer exam. We got a brief view about the syllabus. This syllabus have 5 sections and questions will be coming from general English, aptitude, reasoning, general knowledge and concerned nursing subjects. I advise you to learn more psychiatric nursing questions because NIMHANS is a premier nodal psychiatric hospital in India, and you should focus other nursing subject also in the same way how you are preparing for psychiatric nursing. I also give you the link to download the NIMHANS Nursing Officer detailed syllabus in the comment box. You can click that and you can download the syllabus. Let's see the first question of the day, and also I want to remember you that the duration of the exam is for 90 minutes, so we can expect the questions to be for 100 marks. Let's see the first question of the day. Treatment of alcohol dependence is by all except A. Disulfiram, B. Flumazenil, C. Naltrexone, D. Acamprosate. So, which drug is not used for the treatment of alcohol dependence among these four? The right answer is option B. Flumazenil. Why? Flumazenil is a benzodiazepine antagonist. It is not used for the treatment of alcohol dependence. The benzodiazepines are used in the withdrawal symptoms, treating the withdrawal symptoms of alcohol, whereas disulfiram is used in aversion therapy. Naltrexone and acamprosate are anti-craving drugs. So the right answer is flumazenil. Question number 2. Drugs used for treatment of nocturnal enuresis is A. Trazodone, B. imipramine, C. chlorpromazine, and D. sertraline. So in child with nocturnal enuresis, the drug of choice is option B. imipramine, antidepressant drug, monoamino oxidase inhibitor drug. The rationale, Desmopressin is the preferred drug. It is given at night to reduce urine production during sleep. Tricyclic antidepressants like imipramine, sorry, I have told imipramine as a MAO, but it is a tricyclic antidepressant. It can also be used, but the use is limited because of the side effects. Hence, we prefer desmopressin as the first preferred choice of drug in treatment of nocturnal enuresis. Question number 3. A 62-year-old man seeks evaluation for weakness, a loss of initiative, a loss of weight, and abdominal discomfort. He appears to be depressed. What is the possible diagnosis which can include among these four? Option A, dementia, B, painkiller abuse, option C, pancreatic carcinoma, option D, hyperthyroidism. So the clue you are getting, he is a 62-year-old man and he is having extreme weakness, loss of initiative. So this is the main clue you have to note down. The right answer will be, the probable diagnosis would be dementia. The rationale. So in early stages of dementia, the following signs and symptoms you can note, like memory problems, particularly remembering recent events. Also there will be increased confusion, reduced concentration, personality or behavior changes will be noticed, apathy and withdrawal or depression symptoms also will be visible, loss of ability to, do everyday tasks. Sometimes they fail to take the food by themselves. As a result, there may be weight loss also. So option A, dementia is right. Question number 4. A common features of delirium and and dementia include all of the following except option A, impaired remote memory, option B, cognitive impairment, option C, EEG abnormalities, option D, distorted thought process. So common features of delirium and dementia includes all, but one thing is not present as a common. What is that? The right answer is the cognitive impairment, which is not a common feature of dementia and delirium, which is not common between both dementia and delirium. The rationale in dementia, there is a marked irreversible impairment of cognitive function. But in delirium, the cognitive impairment is reversible and not much significant when compared to dementia. Question number 5. The use of which of the following substances is most commonly associated with violent behavior? Option A, alcohol, B, cannabis, C, amphetamine, D, steroids. The common drug which is associated with violent behavior. The right answer is option B, cannabis. The rationale among all psychoactive substances which can induce violent behavior are firstly cannabis, followed by that alcohol, thirdly opioids, and cocaine finally in the order which increases the risk of violent behavior. Question number 6. Which of the following neurotransmitters is believed to be deficient in Alzheimer's disease? Option A, norepinephrine, B, gamma aminobutyric acid, C, dopamine, D, acetylcholine. The right answer in Alzheimer's disease, the neurotransmitter acetylcholine. Acetylcholine is very less. Apart from acetylcholine, another neurotransmitter called glutamate. Glutamate is also very less. Acetylcholine activates muscle and helps with arousal, short-term memory, and learning. Individuals with Alzheimer dementia have low levels of acetylcholine. So the right answer for this question is option D, acetylcholine. Question number 7. Schizophrenia is characterized by all of the following symptoms except option A, grandiose delusion, B, auditory hallucination, C, flight of ideas, D, parathymia. So schizophrenia is characterized by these symptoms except one. What is that? Right answer is option D. Parathymia is not a characteristic feature of schizophrenia. So what is parathymia? Parathymia refers to blunt affect. Patients react to sad news with cheerfulness or laughter because become sad by events to which normal people react with pleasure. When we are going to some event, sad event, these people who is having parathemia will be very joyful, very happy. In opposite, when we are going to any happiest moment, they will be very sad. So this type of mood change is called as parathemia. This is not a typical feature of any schizophrenic disorder. Question number 8. A 39-year-old man complains of severe anxiety. He feels like a strange thoughts and he has to fight to subdue them. The first step of the management of this patient is option A, to have him admitted to a psychiatric ward. Option B, to ensure him that he has no mental illness. Option C, to explore the correct situation of his life in order to determine the subsequent steps. Option D, to inquire about his childhood events. So the initial step in the management of a patient who complains of severe anxiety, who is having strange thoughts, and who cannot fight against that situation, that will be option C, to explore the correct situation of his life in order to determine the subsequent steps. Yesterday also we have seen similar question that the priority nursing action must be assessment. Followed by assessment, we can go for planning the further nursing care. Question number 9. Which of the following personality disorder is most likely to be associated with a mood disorder? Option A, schizoid personality disorder. B, borderline personality disorder. C, avoidant personality disorder. Option D, paranoid personality disorder. The personality disorder, which is having a close association with mood disorder, particularly depression, is the right answer is option B, borderline personality disorder. Apart from this, dependent personality disorder is also having a significant association with depression, but that is not given here. So we are choosing the uh, borderline personality disorder. Comorbidity with personality disorder in bipolar disorder patient is associated with more difficult course of illness such as longer episodes, shorter time, euthymic and early stage onset, and an increase in comorbid substance abuse, suicidality and aggression. These problems are particularly pronounced in comorbidity with borderline personality disorder. Hence we chose borderline personality disorder, which is having the severe serious association with the depression. Question number 10. A major side effect of monoamine oxidase inhibitor antidepressant therapy is referred to as a cheese reaction. Foodstuffs that may cause such hypertensive crisis include all of the following except A. Coffee and tea, B. Poultry liver, C. Smoked fish, D. Beer and red wine. So which substance to be avoided when you have antidepressant drug in your treatment regimen and when you are able to develop hypertensive crisis because of cheese reaction? The right answer is the cheese, the option A, coffee and tea should be avoided. Cheese, especially aged cheese, which contains substantial amount of tyramine. For this reason, persons taking monoamine oxidase inhibitor antidepressants are cautioned to avoid foods that are rich in tyramine so that hypertensive crisis can be avoided. So the right answer is option A, coffee and tea. Question number 11. Correct statement about agoraphobia includes all of the following except option A. The affected person experiences an intensive, irrational fear of leaving his or her home. Option B. It is effectively relieved by antidepressants. Option C. The affected person realizes that the subject of his or her fear is. Option D. Once a phobia is effectively eliminated, it will not reoccur. So choose the correct statement regarding agoraphobia. One statement is not correct related to agoraphobia. The right answer, option D. Option D is not correct related to agoraphobia. The rationale. Most of the psychiatric problems will have relapse. This depends on the factors such as person's personality traits and environmental factor. Even though you treat phobia successfully, we cannot make sure the disease can come again in our life. When the environmental factors are not favorable to the person, the same thing can be repeated. Question number 12. Violent behavior is most characteristic for which of the following conditions? Option A, bipolar disorder manic episode. Option B, anarchistic neurosis. Option C, melancholia. Option D, somatoform disorder. So violent behavior is characteristic of option A, bipolar disorder, manic phase. The rationale is manic phase of bipolar disorder is characterized by feeling of heightened energy, creativity, euphoria are common during the manic phase. During this phase, people often feel as if they are invincible. However, people often behave recklessly during a manic episode and may also become angry and aggressive. Hope you understood this. Question number 13. Which of the following is a mature defense mechanism usually used by an adult and which helps in social accommodation? A. Shifting, B. Projection, C. Sublimation, D. Avoidance. The defense mechanism which helps a person to accommodate adequately to the society is. The right answer is option C. Sublimation. The rationale here, sublimation is defined as channeling negative urges and impulses into positive socially acceptable behavior. Now let's see the question number 14. The description attributing one's own unacceptable motives and emotions to someone else best characterizes A. Fantasy, B. Splitting, C. Regression, D. Projection. It is also a question related to a defense mechanism. So, which of the statement is related to which defense mechanism in the options here? The right answer, option D, projection. The projection is a defense mechanism in which the person who project their unacceptable qualities or feelings by blaming other people particularly. So that is called projection. Question number 15. The examination of the victim of a violent suicide may reveal option A, a low level of 5-HIAA in the cerebrospinal fluid. Option B, a low level of dopamine in the brain tissue. Option C, a high level of norepinephrine in the cerebrospinal fluid. Option D, an elevated level of most of the biogenic amines in the brain tissue. So which of the following statement here which reveals that a client is having suicide activity, suicide ideation with violent behavior? The right answer, the right answer is option A. A low level of 5-HIAA in the cerebrospinal fluid will be evidence for assessment and evaluate that a person is having a violent behavior with suicide attitude. The rationale here, decreased amount of serotonin and norepinephrine will cause depression and it leads to suicidal tendencies and suicidal ideas. Question number, the 5-HIAA is one of the derivatives of serotonin. So the decreased level of that will leads to suicidal tendencies and suicidal ideation with violent behavior. Question number 16. The psychic structure which regulates the conflicts between unconscious drive and the moral belief is the option A, ego, B, id, C, superego, and D, preconscious. So you all know the stages: id, ego, superego. The question related to that, the right answer is ego, which act as a bridge between unconscious, the id, and moral belief, the superego. So the rationale here, the largely conscious ego stands in between id and superego, balancing our primitive needs and our moral beliefs. A healthy ego provides the ability to adapt to reality and interact with the outside world in a way that accommodates both id and superego. Question number 17. A 30-year-old man complains of impotence. He thinks that strangers on the street are laughing at him. He is sure that they know about his problem and that they are probably responsible for the development of his condition. This complaint should not be regarded as a sign of option A, concreteness of thought, B, somatic delusions, option C, decline affect, option D, delusion of reference. So which is the this complaint should actually here should not be it is should be regarded as a sign of. So not B is not correct in the option in the question. The right answer is related to that. It is a delusion of reference. So note down this not B is not a part of this question. It is by mistakenly typed. This complaint should be regarded as a sign of delusion of reference. So what is delusion of reference? A delusion in which the patient believes that unsuspicious occurrences refer to him or her in person. Patient may, for example, believe that certain news bulletins have direct reference to them, that music played on the radio is played for them, or that car license plates have meaning relevant to them. Ideas of reference differ from delusion of reference in that insight is retained. In the delusion, the insight is not present, but when you have the reference, the insight is retained. So the right answer is option D as per the question. Question number 18. An 8-year-old girl in a febrile state assumes that the curtain in her bedroom window is moving and an animal is trying to come into the room through the window. This symptom is a typical example of option A illusion, B delusion, C hallucination, D phobia. Very critical question, and it is confusing question also, whether we should choose illusion or we should choose hallucination, or it will be phobia or it will be delusion. So what you are going to choose? So we choose that it is a illusion. So why it is not hallucination? Let's see the rationale here. Delusion is a fixed and unshakable false belief. Hallucination is a no stimulus, but along with that, there is misinterpretation and response. But in case of illusion, there is a stimulus and misinterpretation and response also occur. That is illusion. Here, let us come to the question. In the question, what is the girl in a febrile state assumes that curtain in her bedroom window is moving. So there is a curtain in the bedroom. There is a stimulus. If there is no curtain, but the girl assumes that if the girl visualizes that animal is trying to come into the room, then we can choose hallucination. But there is a stimulus and there is a misinterpretation to the stimulus, and the response is called as illusion here. Question number 19. A deficiency of which of the following vitamins is an important factor in the etiology of Korsakoff syndrome? A deficiency of which of the following vitamin is an important factor in the etiology of Korsakoff syndrome? Option A vitamin B6, B vitamin E, C vitamin B1, and option D is vitamin B12. One of the neurological complication of excessive intake of alcohol is Korsakoff syndrome. So which vitamin will be deficient? You all know very well. That is vitamin B1, thiamine. So Korsakoff syndrome is a chronic memory disorder caused by severe deficiency of thiamine, vitamin B1. Korsakoff syndrome is most commonly caused by excessive intake of alcohol or misuse of alcohol. The last question of this video, which of the following symptoms is indicative of barbiturate intoxication rather than drug withdrawal? Option A confusion, B nystagmus, option C postural hypotension, option D disorientation. The question clearly asks which of the following symptom is a barbiturate intoxication rather than it is a drug withdrawal symptom of barbiturate. The right answer is option B. Nystagmus is a barbiturate intoxication symptom. Confusion is also present in intoxication, but it is also present in the withdrawal state. So other three symptoms also present in the withdrawal state, but only symptom which is seen in the intoxication is nystagmus. So nystagmus is the primary toxic effect of barbiturates. Others include slurred speech, ataxia, lethargy, and hypothermia. So we have come to end of the 20 questions of this video. Don't go, still we have two more questions. The subscriber challenge question is waiting for you. Before that, I like to thank my boy Kapil Chef, the nursing officer of VMC Safdarjung, New Delhi, for giving the constant support for the development of our channel, and he is helping all the group members with good notes, and he is having a good human nature. He is helping without having any expectation from others. Thank you, Kapil Bhai. Now you get a chance to win NCLEX books, either Mosby or you the Sounders. You know the criteria very well. What is the criteria to win this book? And now you are waiting for the subscriber challenge question. In this video, I'm going to give two subscriber challenge question. The subscribers of our channel, please answer the subscriber challenge questions in the main comment box with rationale. Then you are eligible for winning the NCLEX Sounders or Moss by book as a small token of love from Satu Career 2.0 online nursing channel for my esteemed subscribers. The first question of the subscriber challenge today, 21. The Most frequent type of schizophrenia among hospital admission is A. The hebephrenic type, B. The paranoid type, C. The catatonic type, option D. The undifferentiated type. Very easy question. Start commenting in the comment box with the rationale. Question number 22. Which of the following is a basic technique of psychoanalysis? A. Hypnosis, B. Free association, C. Empathy, and D. Counseling. Another important easy question for you to comment in the subscriber box with the rationale so that you get a chance to win the NCLEX RN book, either Moss Bay or Sounders. Lucky winners, two lucky winners will be selected on August 6th and they will be announced in the video which we will post after August 6th and they will be get that books. So thanks for watching this video and please subscribe to our channel. Again we will meet with another good questions tomorrow in same time. Take care. Bye bye. Good night.